Morning. My topic is diagnostic utility of CT in TN staging of oral or oropharyngeal carcinoma. Now we can go to introduction. The oral and oropharyngeal carcinoma is one of the top 3 cancer in India, and CT is still the most commonly used imaging modality to assess the stages of oral cavity, and it's widely available and relatively cheap and too easy to perform. CT can delineate the size and extent of the primary tumor and assess the bone involvement, and contrast enhanced CT can identify the metastatic lymph nodes. And HP diagnosis is required before the commencement of the treatment since infiltration can mimic as malignant lesions. Aim to study the oropharyngeal carcinoma is to spread using CT diagnostic and to correlate with the HPE findings. The materials and method, the source of data is like we collected CT reports of 81 reports with oral and oropharyngeal carcinoma were retrospectively analyzed using the hospital information system. The inclusion criteria is criteria are suspicious enhancing lesions involving oral cavity or oropharyngeal on CT, histopathologically proven case of all cavity and oropharyngeal carcinoma, only primary all cavity and oropharyngeal carcinoma cases. Exclusion criteria is CT may not accumulate with histopathologic studies. The methods of collection of data are all scans were done using GE-CCT machine 120 slice MDCT with 120 kilowatt power and 25 milliampere in supine position using standard protocol. Nodal metastasis on CT was defined as lymph nodes with maximum SAD more than equal to 10 mm. CT findings were confirmed with postoperative histopathology. The case was staged according to the 7th edition of the American Joint Committee on Cancer TNM staging. T-score analysis with student t-test were used for the statistical analysis. ACIS committee approval was taken and study was conducted. This image shows the CECT axis section. There we can see heterogeneity enhancing mass along the left lateral border of the tongue in the blue circle, and heterogeneity enhancing enlarged level 2 lymph nodes shown orange arrow. Result and observation. These are the result and observation of age and sex distribution. Mean age of presentation was 55 plus or minus 12 years. In that we can see the 70% and 30% of the female and male representatively. According to the decades, like 10 to 20 decades and the and 40 to 50 decades shown in the bar diagram. Like less than 40 decades, 12 patients, 41 to 50, it is 16, 51 to 60, 24, 61 to 70, 21, more than 78. And the mean age of presentation is 55 plus or minus 12 years. This oil cavity substitute analysis. The comparison of CT and HPV alien positivity are CT has a sensitivity of 79.5%, specificity of 42.9%, positive predictive value of 56.4%, and negative predictive value of 69.2%. Both agree on 14 out of 81 have diagnostic accuracy of 60.49%. The kappa value of 0.0 indicates moderate agreement with AP value of 0.036. The number of compartments involves 33 and valid person 40.7. Number of compartments involves 25 and valid is 30.9, 13, 16 respectively, 7 and 8.6. The involvement of at least one compartment is seen in 30% of the cases, and the masticated space is the most common compartment involved. Number 5. CT tumor maximum dimension is predicting the CT and lymph node positivity and recurrence rates. CT tumor dimension of more than 18.5 mm has sensitivity of 69% and specificity of 57% with predictivity of 62.6% in predicting the lymph node positivity. CT tumor maximum dimension with cutoff as 18.5 has a sensitivity of 78.3% and specificity of 22.2%. PPV value 72% and NPV value 28.6% predicting the METs and recurrence. 23 cases out of 32 cases were in agreement. The kappa value of 0.005 indicates the poor agreement with the AP value of 1. The conclusion, the ECG of the head and neck is the first line modality in many CA cases. All tongue is the most common primary site involved, followed by the buccal cavity. However, peritoneal invasion and lymphovascular invasion which determine the spread of tumor can be appreciated on CACT alone. So MI is useful to announce the tumor action in these cases. CT lymph node positivity has an odds of 4.6 likely to have lymph node involvement. On CT, maximum tumor dimension with cutoff more than 18%, 18.5 mm has a sensitivity of 78.3% and specificity of 22.2% in predicting the mets and recurrence. These are the following references. Thank you.